All right, everybody, welcome to this year's first Jeopardy for the PGY 2s and 3s. Here are today's categories. Follow up with your PCP, shot through the heart, too stable or unstable for a scope, bugs are us, as usual, Sanruka forever, and then history of medicine. All right, you guys know the rules. You pick a value and a topic, and then the question, and there is no negative, so you should guess, and there will be one daily double, which could be any one of these. So we'll start with team 1. What would you want to choose, Rahul?
We're gonna do follow up with your PCP for 500.
Okay, I see you have a bias here. All right. A patient with newly diagnosed HCV comes to your clinic with the following rash. What is the diagnosis? Team 1, what's your answer? You're running out of time.
Hello, yeah, we're gonna go with cryoglobulinemia.
Sorry, what?
Cryoglobulinemia.
Cryoglobulinemia. Are you sure?
That's a good answer.
Okay, too late. So the answer is lichen planus. So patient with newly diagnosed HCV, lichen planus is one of the most common etiologies of this rash. So you can see it's a purple pruritic planar, like the polygonal, the 4 P's. So in a patient with newly diagnosed HCV, this is a very common cause of rash, and you can see that's typically how a lichen planus rash is. So 0 points to team 1 for that. Next, team 2. Max, what do you guys choose?
We will do the poop emoji for 500.
Poop emoji for 500. All right. Name the condition and what the radiographic finding is called. All right, do you have an answer?
We do. This is the rosary bead pattern for polyarteritis. Sorry, primary sclerosing cholangitis.
Okay, all right, I'll give it to you. It is primary sclerosing cholangitis, and it's okay. Rosary beads is also acceptable. It's beads on string. Some people call it rosary beads. So I will take that answer. So that is correct. So team 2 does get. And can anybody, for just for brownie points, name what the test is? Like, what image do you see? What investigation is that? Carlos is being very strict, using half points. All right, so that's what you see on an ERCP. Okay, so team 2 gets 500. Good start. Next, team 3, Connor.
We will take. Hang on, let me check on my team. Last chance, guys. Anyone have a preference? Shot through the heart for 500. I have here.
Shot through the heart for 500. Name the trial which found the following. empagliflozin reduced the combined risk of cardiovascular death or hospitalization for heart failure in patients with HFpEF, regardless of the presence or absence of diabetes. This is, in the recent past came out pre-landmark trial and establishing the role of empagliflozin in HFpEF as well. Let's start the timer.
Sorry, the timer's having a bit of a malfunction. There we go.
Okay, so we're going to go with the Emperor trial.
I need you to be more specific.
You want the full name of the trial?
Yeah, because the Emperor it's a large class. It's not specific. It had more parts. I'll give you half points for Emperor.
Does anyone, any of the, in the cohort with preserved ejection
It's
fraction?
preserved HF. Yeah.
Okay, that is correct. So Emperor preserved is the answer. Yeah, Emperor preserved. So this is the trial which found that in patients regardless of diabetes, SGLT2 inhibitors reduced hospitalizations and cardiovascular mortality, firmly establishing the role of these medications in almost everything cardiac. Good answer by team 3. That gives you 500. So good start by team 2 and team 3. Team 1, you need to catch up. What are you going to choose? That's you, team 1, Rahul. What do you choose? You have three 500s left.
Wait a second. Okay, we're gonna go with Box or Us for 500.
Bugs are us for 500. Let's go. So this is a 5-part question. Each part has 100. So antimicrobial prophylaxis in HIV/AIDS. What I don't want the medication. I want what do you give prophylaxis against? For CD4 count less than 200, less than 150, and I want for 150 there's a star because you need to be a little specific. 100 you need to be specific, and less than 50. And patients who are less than 50, this is the 5th part, who does not need prophylaxis. You can start the timer now. We can run the timer again for this question. It's slightly long. Okay, I think that is enough time. Rahul, do you have an answer? You're not. You're muted.
Are we up in time? We're working on it.
Oh, I think that is it. If you want to answer for part, like you can get 2 parts and get 200, or answer 3 parts and get 300, but I think we need to go now.
Okay, so we're gonna go. So no, for number 1, CD4 counts less than 200. We're gonna go with PCP. We need to prophylact for PCP. For number 2, we will say none for less than 150. For number 3, CD4 less than 100, we need for toxoplasma. For CD4 less than 50, it has to be for see.
All right, so you
With
CD4
yeah, for 50 we don't don't because we used to do for MIA for Mycobacterium IV intracellular, but not anymore. And number 5
you so partly answered it. You answered 4 as MAI, and who does not need MAI prophylaxis? That's the 5th part. All right, so
What
that
are we
is
missing?
times.
Like what category are we missing?
the number 5.
But why, so you answered 4, why is that recommendation done, is why he's saying 5?
Yeah, you're on the right track.
I'm trying to remember.
Do you know why you no longer do MAI prophylaxis at less than 50?
Anybody from the team can unmute and answer.
Yeah.
All right, I think we are running out of time. So you get 100 for PCP. Second part you answered incorrectly. Third part you answered partially, so you get 50. And fourth
Wait,
part.
about the second part, did we say histoplasma if it's an endemic area?
Okay, are you in this? Are you in the same team?
Yeah, we're on the same team.
Yeah.
Okay, so part 2 is correct now.
Okay, great. Thanks.
Part 3, you didn't give the second part. All right, so let's call it a day. You do enough time, so you get 100 for PCP, you get 100 for histo and endemic, you get 50 for toxo, and you get 100 for MAI. So you get 350 points. All right, anybody else from any other team wants to take the rest of the 150?
Wait, for the third part, why did we get?
You guys, I think you third part, there's a star, right? Not everybody will get it for toxo.
So toxo only if your IgG is positive.
Okay, you don't get points for that because it's too late now. I
Oh
could
my God, no.
You want to promote yourself as captain and take over? That's a possibility. But for now, I can just give 350. All right, we scrap the 50 for toxo, but that's the answer, IgG. Anybody want to tell us the 5th and get 100? Team 1 or team?
Angad is on the group. Is on the group. It's on the chat. Gabby put it on the chat.
We have replied a few minutes ago.
Oh, they did? Yeah. All right. So Gabby gets the right answer. Gabby, which team are you in? 1 or 2?
She's in our team. She's in our team. Team 1, number 1.
Okay, this team 1 took too much time. I'm moving on. You get 350. You guys
And
have
I would clarify Gabby's answer, because I wasn't actually agreeing with that one, because the reason that you're at the reason it changed guidelines was because now if you start meds right away and the person's adherent, then they're not going to be at risk for MAC. So I just want to clarify that it has to do with the fact that if you start meds right away, your C4 is going to recover very quickly, and that's why you're not going to be at risk at MAC. So I kind of wanted to clarify that. And part team 1 is a mutiny, so I'm like, I don't know what's going on here. So I'll take off the video. Democracy.
All right. So anybody going forward, if you're in the team and you know the answer, you can shut the captain up and answer for them. So that's 350 for team 1. Moving to team 2.
We'll go with history of medicine for 500.
History of medicine for 500. So Barry Marshall is an Australian physician who won the Nobel Prize for Physiology in 2005. While his discovery has had a major impact in modern medicine, his methods were very unusual. He was deterred by negative experiments on pigs, so he famously drank a broth of dash to prove his hypothesis. He was later proven right when he developed severe nausea and halitosis a few days later. Fill in the blank, and what did he discover? Make this, give me the picture. All right, team 2, do you have an answer?
We will go with what is H. pylori?
What is H. pylori is correct. So Barry Marshall famously, he had a broth of H. pylori as a drink, and it caused severe gastritis, and that's how we discovered that H. pylori is a cause of gastritis. So great answer by team 2. That is 500. Next, team 3. There's 500 left and everything else on the chart. I don't see team 3. Where is Connor? Anybody from team 3 here?
I think his internet shut off.
Abhinav, you want to take over?
Right, for the next 5 minutes. Yes.
Okay. What do you guys take?
Give me 1 sec. Follow up. PCP 400.
PCP for 4. There's a 500 left. Sure.
We're good with the PCP 400.
Okay. Don't want to live dangerously. All right. Which GLP-1 receptor agonist was recently shown to be associated with sustained clinically relevant reduction in body weight? Pretty direct.
Do you want to say Ozempic, semaglutide?
Semaglutide is the right answer. Good job, team 3, right? Yeah, team 3. Great answer. Semaglutide recently shown, maybe probably class effect, but this is the specific GLP-1 used in the trial. All right. Next is team 1 again. Do we have a new captain, or do you still want to be the spokesperson? Go for it, Rahul. We believe in you. Carlos, is it democracy? It's a democracy like Venezuela.
Wait a second. We're working on it. We're working on picking a question.
There's 500 left.
We're gonna do the one with the GI for 400.
Just call it a poop emoji.
The poop, yeah, poop emoji for 400.
Okay. GI for 400. Name the condition and the barium finding. What is the specific name of the finding and what's the condition? Let's start the timer.
So our group decided that it's the name of condition is achalasia, and the barium finding the finding is the Biersbeck. Yeah.
Yeah, birds beat sign.
Yeah.
That's it. Team 1 redeems themselves. Good job. But you still have a little catching up to do. Good answer. Team 2, Max.
All right, we'll go with San Luca Forever for 500.
And that is the daily double. Good choice. All right.
I'm going to ask my team, but oh, well, I guess.
Which special grand rounds is held in October each year in memory of a former SLR alumnus whom we lost in 2006? That's for half. That's for 500. And who was the speaker this year? That's for the other 500.
Do we need more time? I think we do.
Yeah, I think we're done. I think if you give them more time, they're going to go back in their calendars and check. So, team 2, we need an answer.
So it's in memory of Miles Schwartz. Checking the chat to see trying to decide on the speaker.
Okay, I think I'll have to nip you guys in the bud there. That is the incorrect answer. Miles Schwartz is a separate grand rounds, but it's not. It's the combined cardiology and medicine grand rounds held in the spring, which is about to come up soon. Any other team wants to pounce on these points? Team 1 or team 3? So there's a potential 1,000 points available.
The speaker was Girish Nadkarni.
That is correct. Rohit, which team are you in?
Team 3.
Okay, that's 500 for team 3. Anybody else want to give me the name of the lecture? All right, time is up. It is the Karl Nacht Memorial Lecture, and the speaker this year was Dr. Nadkarni, who is an alumnus of our institution. Yeah, so it's held in October every year. It honors Karl Nacht, who died in a bicycle accident, and he was also an alumnus of our institution. So that's 500 for team 3. Good answer, Rohit. Next is team 3 again. Abhinav?
All right, give me 1 second. We want to go shot through the heart 400.
Shot to the heart for 400. All right, name the EKG finding and give a common cause for this finding. Start.
We want to say it's an epsilon wave arrhythmogenic right ventricular dysplasia.
You sure? All right. Unfortunately, it is the incorrect answer. Epsilon wave appears in a similar position in the wave, but this was actually an Osborn wave, which is seen in hypothermia. So incorrect for team 3. I am sorry. Moving forward to team 1.
So we're gonna go with Bucks or Us for 400.
Bugs are us for 400. All right. What is the indication for IV Metronidazole in C.diff? right, team, this is team 1, right? Yeah, team 1. Your time is up.
So, yeah, I think one of my people on the team will like to speak up.
Who is it?
So basically, do you want just the indications? Or do you want just like to say for us just to say like fulminant disease, or is that okay with your answer, or do you want more specifics?
Fulminant is correct. I'll give you half points, but you also, if you tell me, you have to tell me what fulminant is.
Okay, so we'll define fulminant for you. Basically, if you have like an organ damage, including like creatinine more than 1.5 or more than, like if you have an AKI, you have a white count more than 18. If you have a evidence of megacolon as well, as part of the.
So I will stop you there. I will give you half points because you got half of it right, but you have mixed up fulminant and severe. So the answer is fulminant. Fulminant means C.diff with hypertension or shock, EDS or megacolon, creatinine more than 1.5 and the WBC count more than 20. Those are severe. So that's a separate thing. You don't treat severe, but you only treat fulminant with IV flash. So you only get half the points. That was Bugs R Us for 400, right? Yeah, so you get 200. Right, moving to team 2.
All right, well, we'll stick with our history prowess and go history of medicine 400.
Good choice. The Bellevue Stratford Hotel in Philadelphia, which is pictured here, was the venue for the 1976 American Legion Convention. However, this hotel was shortly closed after the convention due to an incident which is now well known in medicine. What is the medical significance of this hotel, and what incident are we talking about? You got it? Go for it.
So this was where Legionnaires was identified.
Perfect. First known outbreak of Legionnaire's disease named after the American Legion Convention. Good answer. This tells you should go for history. Team 2 gets 400. Team 3, what do you want to go for?
Connor is back.
Sorry?
Connor is back.
Oh, Connor is back. Where is Connor? Connor, you're muted.
So I'm back for now. I'm hotspotting from my phone, so we'll see. But I think we'll go for St. Luca Forever, 400.
San Luca for 400. All right. Which associate program directors completed their residency at SLR? I want an exhaustive list. All right. Team 3, do you have an answer?
Yes, we have Dr. Goldberg. We have Dr. Rosario. Sorry, not Dr. Rosario, Dr. Viola.
I'm going
Sorry.
to stop you guys there. That is incorrect. Anybody else wants to pounce? Team 1 or team, team 1 or team 2?
Edelman, Dr. Edelman.
That is partly correct. I will give you half points. So you said Dr. Edelman, which is correct.
Oh, and Laura Bach is now also an associate program director?
She's an assistant program director. So the answer is Dr. Pregolini and Dr. Edelman. You will get.
I would direct you guys to see the chief resident. plaque at Morningside and look at the first name that's there.
Literally
And
the
that is
first
Dr. Alejandro Frigolini, just so that you guys know.
So don't get fooled by things. Dr. Prigolini was a chief here, and Dr. Edelman and Dr. Rothman did not complete his residency here. He just did his fellowship. All right, that was 400. So you guys get 200 for Dr. Edelman. Next is team 2.
But Angad, you should give it to team 1. I'm from team 1.
You're from, oh, you answered it. Okay.
Yeah.
Team 1. Team 1 gets 200.
Thanks.
Next question. This question was for whom was this question for?
Team 1 is up.
Team 1 is up. Okay. Team 1. Sophia, you want to pick a heading? Or Rahul?
About the PCP 300.
PCP for 300. What form do you need to fill for a patient to get a home health aid? I want the exact name of the form. Okay, Rahul has already answered. That was very fast. It is the M11Q. Good. Rahul gets 300. That was finally Rahul living up to his chosen specialty. Next, team 2.
All right, we'll stick with history of medicine, 300.
Good choice. I agree with that. Name this place and describe its significance in the field of medicine. All right. Do we have an answer?
So this is a surgical theater where surgeries were observed.
Were
you asking like where specifically?
The name, and I want there were lots of surgical theaters, right? What's the significance?
So this was the first operating theater at the University of Pennsylvania.
That is incorrect. Team 1 or team 3, do you want to pounce? Do you want to pick up these points instead of team 2? Any guesses? Anybody can unmute themselves or put it in the chat. I will wait for 5 seconds before giving the answer. You need to move a little faster now. Fatma says National Library of Medicine. No.
I think it's like in Mass General. It's like the surgical theater there.
So you're close, but I want it to be a little more specific. All right. So it's the Ether Dome. It's called the Ether Dome. It is in Boston and Harvard. It's the first operation theater where ether was used as an anesthetic agent in front of a public audience, and that was the first known use of anesthesia. So that's you can see, people doing public surgery without gloves, but at least they gave the patient anesthesia. That was history of medicine. For 300, nobody gets those points. Who wants to go next? This is for team 3 now, right?
Yeah. We will go for Bugs R Us for 300.
Bugs R Us for 300. Name the bug and the findings seen in this meal. All right. Do we have an answer?
So we're going to say that's a Maltese cross of babesiosis.
Great. Babesia, Maltese cross. Great answer. Pretty on theme with today's lectures. We're going to start moving a little faster. Next question is for team 1.
Is it our turn?
Yep, Rahul, your team.
I'm gonna go with the whoopee sign for 300.
You have 300. Give 3 indications for SBP prophylaxis. All right, do you have an answer?
Yes. So one will be variceal bleeding. The other one will be prior prior SBP in the past, and also having a low a protein and the a low protein below. Sorry, let me rephrase that. Acidic fluid protein level less than 1.5, I believe.
Great answer. So patients with cirrhosis, and not just variceal bleeding, but any non-variceal GI bleeding as well. So it's just the blood in the GI tract, which is the problem, not that it's from the varices, but obviously they're cirrhotic, so GI bleeding, so variceal bleeding will be more common. So that's an indication for primary prophylaxis. Patients who have had 1 or more episodes of SBP in the past, lifelong, that's secondary prophylaxis. And then patients with cirrhosis with low protein, less than 1.5 grams, is another indication. Anybody know the pathophysiology of why low protein causes higher risk for SBP?
No opsonin activity.
Exactly. So the protein acts as an opsonin, and low protein makes the innate immunity weaker. Great. Let's move forward. We're short on time. So team 2.
We'll go with a shot through the heart, 300.
Shot through the heart for 300. Very simple. Just name the murmur, or name the condition in which you'll see this murmur. Two, one. All right, I think that's enough time. This is a very direct question. Do we have an answer?
We'll go with aortic regurgitation.
That is incorrect. Does anybody else want to pounce? Team 1 or team 3? Carlos, unmute yourself. Which team are you in?
Number 1.
So team 1 gets it correct. It is mitral stenosis. It's a mid-diastolic rumbling murmur. Can you name the parts of the murmur? This is labeled its opening snap.
Yeah.
Then this is the rumbling part, the mid-diastolic rumbling murmur, and this is, can you name this?
Doesn't come to mind right now, to be honest.
So this is the pre-systolic accentuation. This is when atrial filling increases the increases the intensity of the murmur. And then between S1 and S2 is the systole. This is the diastole. This is when the mitral leaflet has opened up. So this is the opening snap. And this is when there is turbulent flow across the stenotic valve. All right. That is points for Carlos's team, which was team 1, right?
Yes.
All right. And whose turn is it? This is team 3 now. This was this previous one was for team 2, next for team 3.
Okay, so we'll go for my team. So say Bugs or Us again for 200.
Bugs are us for 200. Name 2 indications for WAG or gram-positive cocci coverage in neutropenic fever. All right. Do we have an answer? Any 2?
Any 2. So we have a indwelling line
Okay.
and a severe infection with hemodynamic instability.
All right. Those are 2 correct answers. So other answers are, if you have a radiographically documented pneumonia, as we talked about lines, then positive blood cultures for gram-positive bacteria. If it's a skin and soft tissue infection, you need to cover for staph and then severe mucositis as well. So good answer, team 3. Should we quickly tell them the points? Rafa, do you have a count of the points?
We've decided not to disclose it at this time. I'm kidding. Rafa, you have the mic. Just 1 second. He's making final calculations.
So team 1 is at 2050, team 2 is at 1400, and team 3 is on 1900. So it is pretty close between team 1 and team 3. Team 2 will need some, some prayers right now. We still have 5 minutes, so we can quickly go through 2 or 3 questions, and then we'll stop sharp at 4. So team 1, do you want to go for 300 points? You can increase your gap between team 1 and team 2 and team 3. All right, let's hurry up.
So we are
Rahul, come on.
okay, we're gonna go with San Luca forever, 300.
300. Okay, good. Which famous surgeon is credited with performing the first radical mastectomy for breast cancer at Roosevelt Hospital?
¿Te refieres aquí a Montana West? Okay, Roosevelt. Sorry for the Spanish speakers. Sorry.
All right. Do you have an answer?
Dr. Halstead.
Correct answer. That is William Halstead. Something you must have listened during your recruitment here, as well as seen on the walls of Mount Sinai West with his portrait up there. All right. Good answer. Next for team 2.
We'll go PCP 200.
PCP for 200. What is the definition of resistant hypertension? Straightforward. All right, let's start the timer. Go for
So it would be uncontrolled high blood pressure on 3 meds, one of which is a diuretic.
it. Just one more qualifier. I'll give you the points, but one thing you want to specify about the meds.
Sorry, can you say that again?
Just one more thing you need to be a little more specific about, but yeah, I think you have the answer. Like you're 99% there.
All prescribed at optimal doses.
Yes, that is correct. That is all I
Okay.
needed. So it's 3 medicines, optimal doses of different classes, and one of the agents is a diuretic. All right, that is the correct answer. Points for team 2. Now team 3. Possibly the last question of this Jeopardy.
So we need the $200 so our points. So I think we'll go shot through the heart for 200.
All right, we have another EKG. What abnormality is seen, and give the most common cause. All right, do we have an answer?
So we're going to say U-wave and hypokalemia.
Bingo, that is correct. Those are U waves, that is hypokalemia. So 200 for team 3. I think we are almost at time, but we can do a rapid fire. So what I'll do is I will select the question, and then anybody in the audience can shout out the answer. If it's the correct, your team gets points. Is everybody okay with that? On board with that? All right. So let's do a quick rapid fire. Let's start with GI. Name the endoscopic finding.
Barrett's esophagus.
Esophagus.
So Connor got it first. That is correct. Barrett's esophagus. Connor's team is team 3, right?
Yeah.
So that's points for team 3, 200. Next, San Luca for 200. What does WARP stand for?
Weekend Alternative Resident Pool.
That is not correct. Anybody
Weekend
else?
Ambulatory Resident Pool.
That is correct. Rohit, which team are you in?
Team 3.
Team 3 gets the points.
Yeah.
Connor is very happy. History of medicine for 200. Whose hand is this, and what is the significance of this image?
Ranjan's wife.
Ranjan's wife is correct. And what's the significance?
First, what do you mean? This is the first X-ray. I don't know.
Yeah, that is
Wasn't it the
correct.
first X-ray, whatever.
First X-ray. Abhinav, which team?
3.
3. All right, that's another 200 for 3. Next question, follow up with your PCP. According to the USPSTF, who needs to be
Any
screened?
smoker.
Smokers over 50.
Men smokers over
Over
65.
All right, Chris,
65.
Chris is the first one to
52.
get the answer. Chris is the first one to get the full answer. It is smoker 65 to 75 with ultrasound who smoked ever. All right, shot through the heart. Name the congenital abnormality depicted here.
That's
Epstein
atrialization of the right ventricle. That's the Epstein.
Epstein's anomaly.
Okay, so lots of people said it. Who said it first? Did anybody notice? Did Connor say
I
it?
spoke first. I said atrialization of
No,
the right
he was
ventricle.
explaining it.
I think I said the name first, I think.
Yeah, I think Connor said the name first. You said atrialization of the right ventricle, but I heard Connor say the name first, so that goes to Connor's team. All right, I feel like I'm being a judge here. So 100 for GI. Any one risk stratification score for upper GI bleeds. Any one.
States and say use.
Glasgow-Blatchford score.
Okay, yeah, that is the right answer by Rohit. Glasgow-Blatchford is one of them. There's rock collar name 65. Rohit, which team?
Team 3.
Team 3 again.
Team 3. All right. On a roll. Bugs are us for 100. Which tapeworm is associated with vitamin B12 deficiency?
Fish tapeworm.
Ascaris.
Fish
Phyllobotrium.
tapeworm. Fish tapeworm. Fish tapeworm.
I can't even tell who's speaking first now. So this one doesn't go to anybody. I follow with.
Oh, that's a fish tapeworm.
Yeah, but I couldn't tell who was first, so I think we're going to make that question null.
I see.
All right. So look up for 100. Which former chairman of medicine and SLR has a genetic disorder?
Leshnaim.
Right.
Dr. Suar, Dr. Suar. Wait.
No, it's not Dr. Suar. Yeah, this one goes to Max. 1 second. And my thing is bugging out. 1 second. All right. And the last question for 100, that was climactic. In 1928, X started his research on staph. During his research, X noticed that an uncovered petri dish near an open window became contaminated with mold. X realized that the bacteria near the mold were dying, which helped him isolate and identify why. Give me both X and
penicillin.
Y. That is correct. That is why. What is that? Who is X?
Alexander Fleming.
That is correct. So Connor, which is team 3, gets these points. That is 100. And that is the end. Can we have the final scores? Drum roll. Can we get a drum roll from somebody?
Okay.
I'm searching on Spotify.
Nice.
That sounded more like guns. Do we have the points? All right. So team 1 is on 2350. Very well played. Team 2, 1700. Good job. Team 3, wow, you really took it away in the rapid fire. 3000. So good job, team 3. Please everybody clap. Good job. And that is it for this Jeopardy. Thank you, everybody.